Hi, everyone. My name is Shelly, and today I will be talking about the new mental health crisis hotline in the United States and how we as a society can work to destigmatize mental illness. So first, a little bit about me. I am a rising senior MICDS in St. Louis, Missouri. I am incredibly passionate about global health, medicine, and raising awareness of mental health issues. At school, I am extremely involved in my school's debate team as well as robotics team, where we work to promote women in STEM. In my free time, I love to paint, dance, and read. My connection to this topic is an initiative called MIST that I founded in the spring of 2019 with my friend. Our goal is to reduce the stigma surrounding mental illness by raising awareness in our communities. In the past, we have given presentations in schools in India, Singapore, and the US, and now we have chapters and volunteers across the world. Our chapters are located across the US, India, UAE, Indonesia, and beyond, and we currently have over 150 high school students involved worldwide and over 10 chapters. And to this day, we are still growing and evolving. Last year, we launched a newsletter which students can write for, and now we also have a podcast where we interview various guests on various topics, from body image to social media and more. You can learn more about MIST on our website or on our Instagram at MIST_teens. So on to today's topic. First, I will be discussing a bit of background on the current mental health crisis that is going on in our world today. Then I will shift to a discussion on the crisis hotline and some latest news on it. And finally, I will conclude by talking about how we can end the stigma surrounding mental illness. Just as a trigger warning, I will be discussing some statistics about mental health prevalence and suicide in this presentation. So to start off, what is mental illness? As the definition on the slide states, it's a range of medical conditions that affect the mind, which include depression, anxiety, bipolar depression, eating disorders, and addiction, just to name a few. Mental illnesses are extremely common. In fact, 1 in 7 people, or 14% of the world's population today, live with one. That is close to 1 billion people in the world. These illnesses do not discriminate. They can affect anyone of any age, regardless of race, gender identity, social class, etc. However, most of these people do not receive help, and one of these reasons is the stigma surrounding mental illness. Many people fear that they will be judged and shamed for wanting help. In the US specifically, 56% of adults and 62% of youth do not receive help. And on top of that, many people do not have access to treatment due to a lack of resources. In the US alone, 21% of people with a mental illness report not having access, and the ratio between mental health service providers to the US population is 500 to 1, with most of the professionals concentrated in wealthier urban areas. This ratio is even lower in low-income nations, where on average around 75% of people do not have access, and the ratio is 0.1 to 100,000, as you can see from the slide. Even in areas with access to resources, receiving help is extremely expensive, as most services are not covered by insurance and many people are unable to afford it. Suicide is the 18th most common cause of death globally and the second most common cause for adolescents in the United States. 800,000 people die each year from suicide across the world. However, each and every one of these deaths are entirely preventable. So what can we do to reduce this number and to save lives? One of the strategies that most nations have used is enacting a nationwide mental health crisis hotline, which people can call if they need help. These numbers can be called at any time in emergency situations or if someone just needs emotional support or needs help in supporting someone else. Calling a hotline is completely free and confidential, but they are not substitutes to long-term therapy. These hotlines are typically staffed with trained mental health professionals and volunteers. In the United States, the nationwide number is the National Suicide Prevention Lifeline, which is available in multiple languages, as well as for people who are deaf or hard of hearing. There is also the crisis text line. There are also other hotlines across the country that cater to certain regions and to cities or to certain communities, such as certain underrepresented minority groups. While the numbers listed on the slide are specifically for the US, almost every country has their own hotline. These hotlines can be reached by anyone with a phone, which helps to make an immediate mental health resource more accessible and is a key step towards saving lives. The important part is making sure people are aware of and have confidence in these resources. So what happens when someone calls the National Suicide Prevention Lifeline or any other similar hotline? First, the caller is rerouted to the nearest crisis center to them, where a trained crisis worker answers the phone. When the call is answered, the caller can discuss anything that they would like, and the worker works to support them and helps them to feel safe. They may direct the caller to outside resources that they can use in the long term or help them come up with a safety plan, especially if they are in a crisis. If the caller is calling about the safety of another person, the worker will tell the caller how to help them. In July of 2020, the US Congress approved a new number for the National Suicide Prevention Lifeline, 988. This change will take place as of July of 2022. So why is this important? This is a major step towards ending the stigma of mental health in the United States. First of all, shortening the number will make the hotline even more accessible to people, since looking up a 10-digit number in a crisis can be extremely difficult. Secondly, shortening the number into something that most people can remember will help normalizing calling the number and seeking help. Mental health is an extremely stigmatized topic, and this prevents many people from getting help because they fear that they will be judged for it. So, how can we as a society end the stigma surrounding mental illness? We have to do the exact opposite thing: talk about it. By speaking up and educating our communities, we can create a more welcoming environment and normalizing asking for help. Another thing that needs to be done is portraying mental illness in a more positive light in the media in a way that does not misrepresent the issue. To conclude, the crisis hotline number is an extremely vital part in making mental health services more accessible and saving lives. But is simply shortening the number enough? While shortening the number is an important step towards normalizing reaching out for help, there is still a long way to go in completely eradicating the stigma of mental illness. A lot of people wonder what they themselves can do. Well, of course, spreading the news and raising awareness of the hotline number and mental health as a whole is important. The most important and significant thing you can do is actually quite simple. Be kind to everyone. It is so simple but so important that we work to create a welcoming environment where we can support each other and make mental health a judgment-free topic, which in turn will save countless lives. I want to take a moment to acknowledge a few people. First off, thank you to my family and friends for the continued support and encouragement. Thank you to everyone who is a part of MIST who has helped to make this vision a reality. Thank you to the GHLC team for giving me this opportunity to speak today and for organizing this amazing conference. If anyone wants to reach out to me with any questions from this presentation, you can reach out to me at the email listed on the slide. Thank you all so much for listening. And here are my references.